have disfiguring surgeries. So another support organizations began forming based on personal experiences like Rose. People started speaking out because they felt that their needs were being unmet and they weren't being heard. So the very first organization for breast cancer that formed, of course, is Susan G. Komen. It was started by her sister Nancy Brinker after Susan struggled with her breast cancer, and she was diagnosed at age 33, which at the time was considered extremely young. And so advocacy started. People started talking about it more and finding out what treatments and what kinds of surgery, and they started questioning the surgeons and the procedures, and this was not well taken by the doctors because, of course, they were still very omnipotent at that time. But as patients put pressure on them, they have to start looking into something. So there was a bunch of well-publicized advocate-backed legal pleas, and the very first one of this was the stem cell transplant. It was not cleared for access by all by the FDA, only people who were in clinical studies. And this is an ongoing problem in the advocacy world, is that there are some very promising studies, but because of the way that we have set up our research system, it can't be given to just every patient who might qualify until after it's gone through 3 phases of human study. And this was very debatable because when we had the AIDS groups in the 1980s, they were also fighting for the same thing, to get access to treatments that were promising, but they hadn't gone through the whole clinical trial process that we have in place. So the first thing for the breast cancer was stem cell transplant. I actually had a friend that was doing this at Duke University, and many, many metastatic patients were asking for this. And actually they went to court, and some of the advocate organizations went to court believing that very strongly that this was something to save people. But as it turned out, after they did an accelerated process and were letting people into it, it was not an effective treatment. And so we learned a valuable lesson as advocates that we needed to be better trained before we asked Congress and other people to help us out. So they started looking at how to do this, and the National Breast Cancer Coalition is a very, very interesting group of women, lawyers and surgeons and journalists who went through the whole civil rights movement and the women's rights movement, and they decided that they needed to apply the same principles for educating people as they did when they were looking at the women's movement. So they moved it from personal to political. And this does happen to people, but a lot of times people in Congress and businessmen aren't interested in hearing a personal story. They want to know what's in it for them. And so you have to move into a political strategy. So the grassroots people for that, for the group for this launching it, was Susan Love, who's a breast surgeon and she's a survivor, Susan Hester, and Amy Langer, and Fran Visco, who is currently the president of the National Breast Cancer Coalition, was the person that really grabbed this by the horns and moved forward the agenda about how to scientifically train advocates. How do we do this? And so they developed something called the Project Lead. When I attended it in 2004, it was 4 intense days. Now it's 5 to 6 days. But as you can see, this was the book that we were given, and it's about 3 inches thick. And upon arriving, this is what we were given, and we spent 4 days from 7 a.m. until 8 or 9 at night with top experts in epidemiology and how to set up studies and the biology of cancer and cell biology and how everything worked. And it was really very intense, but we learned a lot, and it was good. And we had some presentations that we needed to make at the end to show that we had grasped most of the information. But this was what they started with. They started with this Project Lead, and you have to apply for it. And you have to be really focused on this because there is a lot of science, and it's a lot to learn and a lot to keep in mind as you're moving from